87-year-old Margaret Thompson was placed in a private care home by her family, who thought she would receive the best care. 3 months later, she died after losing 55 pounds. While the family thought it was a natural aging process, what Patricia Williams reveals tonight shows that Margaret's story was actually the result of deliberate neglect. It's exactly 10:45 p.m. on a quiet night in Denver. I'm sitting in a small office in the city center. Across from me is Dr. Patricia Williams, a 55-year-old woman who ran the luxury elderly care home called Sunset Care Center for 18 years, carrying deep regret in her eyes. Tonight she has decided to listen to her conscience and is prepared to reveal the darkest truths about America's elderly care industry. Do you remember Margaret Thompson? Dr. Williams begins, her voice trembling. 87 years old, a retired teacher, volunteered at charity organizations, mentally very sharp. Her family wanted to give her the best care and paid us $12. Margaret's story is a tragic example that exposes the distortion in America's elderly care system. When Margaret arrived, she weighed 72 pounds. Her health was good, she only had mild diabetes and blood pressure problems. When she died 3 months later, she weighed 117 pounds. She had lost 55 pounds, but this wasn't a coincidence. What Dr. Williams reveals seems unbelievable at first. But the documents, photographs, and records in her possession expose a horrifying truth. Some elderly care homes systematically neglect their residents to accelerate their deaths. While we should have given Margaret 3 meals a day, we gave her 1 meal, she confesses. While we should have given her medications regularly, we gave them at half doses. The reason was simple: the faster we could kill them, the less we had to spend. The biggest scandal is in the systematic neglect system, says Dr. Williams, placing a thick file on the table. The basic needs of the elderly are systematically not met. Food, medication, hygiene, everything is consciously restricted. When she opens the file, the scene before me is shocking. Margaret Thompson's meal chart. While she should have been receiving 250 calories daily, she was getting 800 calories. Instead of diabetes medication twice daily, it was given 3 times weekly. Bath times were marked once weekly. Because, she explains, the longer each elderly person lives, the more cost it means for us. Food expenses, medication costs, staff costs, electricity, water bills. That's why we preferred to graduate the elderly as quickly as possible. This situation isn't just a financial calculation. It's a humanitarian tragedy. Margaret constantly said she was hungry, she recounts, but we told her appetite decreases in old age, when in reality she was literally dying of hunger. The second scandal is in food restrictions. The elderly's food quantities are systematically reduced, says Dr. Williams. We show families luxury menus, but we serve very different food in reality. Among the documents are Margaret's actual meal records. What was written on our menu: fresh salmon, vegetable soup, fruit dessert. What Margaret actually ate: stale bread, water, sometimes a little chicken broth. The reasons for this situation are horrifying. Food cost per elderly person is $45 daily, she explains. But we spent $8 daily. The remaining $37 went directly to profit. In her final days, Margaret constantly wanted food. Dr. Williams recounts, her eyes filled with tears. She would reach out her hands and say, "Please, just a piece of bread." But we refused her, saying it's not suitable for your diet. That woman died of hunger, and we did it under the name of diet compliance. The third scandal is in the medication cutting system. The elderly's medications are systematically reduced or completely stopped, says Dr. Williams. We tell families she's taking her medication regularly, but the reality is very different. Margaret's medication records reveal a dire situation. Diabetes medication twice daily became twice weekly. Blood pressure medication daily became every 3 days. Calcium supplements were never given. Because, she explains, medication cost per elderly person is $800 monthly. But we spent $50. When the elderly got sick, we explained it as age progression. This medication restriction accelerated Margaret's death. In her last month, she constantly had high blood pressure. But instead of giving medication, we said it was normal in old age. When she had diabetes crises, we also said it was what old age brings. The fourth scandal is hygiene neglect. The elderly's cleanliness needs are systematically neglected, says Dr. Williams. Bath times are restricted, laundry washing is reduced, room cleaning is delayed. Margaret's hygiene records show the horrible situation. She could bathe once a week. Her laundry was washed every 10 days. Her room was thoroughly cleaned once a month. Because, she explains, every hygiene procedure means staff time and materials, water bills, detergent costs, staff wages. Reducing these increases profit margins. This neglect led to health problems. Margaret started developing skin infections, she recounts. But we attributed this to aging, when it was actually due to lack of cleanliness. The fifth scandal is psychological torture. The elderly are systematically driven to loneliness, says Dr. Williams. Family visits are restricted, social activities are canceled, communication is blocked. Margaret's psychological condition gradually worsened. She constantly wanted to talk to her family. But we restricted phone calls, calling them disruptive. We limited visitors, citing infection risk. Because, she explains, the less the family visits, the less the elderly person complains. And we can do our job more comfortably. This isolation drove Margaret into depression. In her final period, she was constantly crying, Dr. Williams recounts. She was asking why she came here, saying she wanted to return home. But we reported this as dementia symptoms. The sixth scandal is medical neglect. The elderly's health problems are systematically ignored, says Dr. Williams. Doctor examinations are restricted, tests and analyses are delayed, treatments are postponed. Margaret's medical follow-up records show the extent of neglect. In her last 2 months, she had no doctor examination. No blood tests were done. Even blood pressure measurements were irregular. Because, she explains, every medical procedure means additional cost. Calling a doctor, getting tests done, buying medication, reducing these increases profit rates. This medical neglect accelerated Margaret's death. In her last week, she was experiencing heart rhythm disorders. But instead of calling a cardiologist, we said it was the aging process. Instead of taking an EKG, we said it was unnecessary. The seventh scandal is family deception. The care home, we show families and the real care home are completely different places, says Dr. Williams. When family came, we dressed Margaret in her best clothes. We gave good food that day. We gave her medications at full dose that day. This way the family was satisfied. This show hid Margaret's real condition. After the family left, everything returned to the old way. Bad food, less medication, neglected hygiene. Margaret's daughter said, "My mother looks very good during her last visit," Dr. Williams recounts, when in fact Margaret had fainted that morning. But we didn't tell them that. The eighth scandal is financial exploitation. There's a big deception in the money families pay, says Dr. Williams. The actual cost spent on Margaret, who received $12,000 monthly, wasn't even. How is this possible? Monthly food expenses $240s, medication costs $150s, hygiene materials $140s, staff share $800, total $12,390s. The remaining $10,710 went into pockets. Even after Margaret died, we asked the family for money, she confesses. Final care costs, special cleaning fees, funeral preparation money. We took another. How do you live with this situation? I ask. Dr. Williams's tears flow non-stop. I see Margaret in my dreams every night, she says. She tells me, "Doctor, I'm so hungry." I tell her it's good for your diet. But the hunger and despair in her eyes never leave my mind. At Margaret's funeral, her daughter thanked me. She continues. She thanked me for taking good care of her mother. At that moment, my conscience was shattered, because I had killed Margaret. At the end of this conscience reckoning, she decided, enough. People need to know the truth. Is it only Margaret like this? I ask. The answer is horrifying. In the last 3 years, 47 people died in our care home, she says. All the same way. They were left hungry, without medication, neglected. But none of their families learned the truth. This means the problem is systematic. When I talk to other care homes, I learn they use the same methods, because this is the standard of this industry. 82-year-old Robert Martinez lost 66 pounds in 6 months. 91-year-old Dorothy Chen went into diabetic coma because she was left without medication. 79-year-old William Davis died from infection due to lack of hygiene. All like Margaret. Can this system change? I ask. Dr. Williams doesn't look hopeful. Only if families learn the truth, she says. Currently, families think their loved ones are receiving good care. If they learn the truth, we can't do this job. Also, independent inspections are essential, she adds. Unannounced inspections, one-on-one interviews with the elderly, detailed health checks. What I told you tonight, says Dr. Williams, is just the story of one care home. But similar practices are common in this industry. Margaret Thompson's death happened under my hands. But I won't stay silent anymore, because if I stay silent, more Margarets will die. Her final sentence echoes in my ears. Every family should do very careful research before placing their loved ones in care homes. Because when you close that door, you might not know that your loved one will be slowly killed. The story I heard tonight isn't just Margaret Thompson's story. It's the bitter reality of America's elderly care system. And confronting this reality is all our responsibility. Because today, Margaret was elderly. Tomorrow we will be elderly. And then we risk facing the same system. The truths that Dr. Williams courageously shared, I hope, will be the beginning of change, because our elderly don't deserve the suffering Margaret endured. At Golden Years Care Center in Portland, where Margaret's sister Helen was also placed, similar patterns emerge. Helen lost 40 pounds in 4 months before her family moved her to a different facility. Riverside Manor in Seattle shows identical practices. Multiple families have reported dramatic weight loss in their elderly relatives, always attributed to natural aging processes. Peaceful Meadows in Phoenix recently faced a lawsuit when the Johnson family discovered their father had been receiving only 1 meal per day instead of 3, despite paying premium rates for comprehensive nutritional care. The pattern is clear and nationwide. Margaret Thompson's tragedy is being repeated in facilities across the country, hidden behind polished brochures and reassuring family meetings. Dr. Williams now works with federal investigators, helping to expose this industry-wide crisis. Her testimony has already led to investigations at 17 facilities in 4 states. But for Margaret Thompson, justice comes too late. Her daughter keeps her mother's favorite photo on the mantle, Margaret smiling at her 85th birthday party, healthy and vibrant before entering Sunset Care Center. I should have asked more questions, Margaret's daughter told investigators. I should have made more surprise visits. I trusted them with my mother's life, and they betrayed that trust in the cruelest way possible. The reforms being proposed include mandatory unannounced inspections, family access rights, and criminal penalties for willful neglect. But implementation faces resistance from an industry built on these very practices. Dr. Williams's final reflection. Every night I think about all the Margarets I could have saved if I had found my courage sooner. That's my burden to carry. But maybe sharing this truth can prevent future families from experiencing what Margaret's daughter went through.